Researchers are studying how COVID-19 impacts pregnant women and their babies. Danya Backus introduces us to a mom who had coronavirus during a very high-risk pregnancy.
Alicia Shepard was 5 months pregnant with triplets when she tested positive for COVID-19.
Exhaustion and real, very hard shortness of breath, awful hard cough that, it was hard enough I cracked a rib.
With COVID being a new illness, she didn't know what to expect.
What was that like?
My gut just sank with this fear of, I didn't even care about me, but this fear of what will this mean for our kids?
Researchers are learning more about how COVID can affect pregnant women. Alicia took part in a UCLA study looking at nearly 600 pregnant women who tested positive for COVID.
What we've seen so far is generally that patients do well overall. They don't tend to have as much fever, but they do present with cough and very much similar cold symptoms.
Most pregnant women had mild disease and didn't need to be hospitalized, but a quarter experienced symptoms that lasted 2 months or more. Dr. Rashmi Rao is a maternal fetal medicine physician.
Those that have severe COVID tend to have a little bit of an increased risk of adverse outcomes, and that can be either delivery by C-section, delivery a little bit earlier, so preterm delivery.
After recovering from COVID, Alicia went into labor at 28 weeks. Doctors don't know if COVID caused the early delivery or if it was just the nature of the pregnancy. Her 3 daughters spent more than 2 months in the NICU, but are healthy and thriving.
If my experience of what my family went through with COVID can provide data that's going to help someone else's family, then I'm all in for that.
And they are all in for what's next as a family of 6. Danya Backus, CBS News, Los Angeles.
The researchers also studied immunology, finding most mothers who had COVID passed antibodies onto their babies. Alicia's babies there carried the antibodies. Health officials are urging Americans to donate blood as the nation faces a severe shortage. According to the American Association of Blood Banks, the blood supply is dangerously low at centers nationwide, meaning the majority of blood centers have less than 1 day's supply. Medical facilities are using more blood due to a rise in trauma cases, organ transplants, and elective surgeries, which were placed on hold during the pandemic. The shortage is forcing some doctors to reserve blood products for only the sickest patients. Locally, you can donate blood with Vitalant or the American Red Cross. Amazon Prime Day is here, but this year, other retailers aren't taking it lying down. We'll tell you where you can find the best deals right after the break.